Today we're going to focus on Module 42 and we're going to finish our series on therapies by focusing on biomedical therapies. So biomedical therapies are interventions in the brain and body that can affect mood and behavior. So we're introducing something, either an electrical stimulus or a chemical. So we're actually changing the brain's functioning by altering its chemistry with medications, circuitry, magnetic impulses, surgery, etc. So the primary therapy that we use today is medication in addition to psychotherapy, obviously. And this is called psychopharmacology. And that refers to the study of drug effects on mood, behavior, and the mind. So we know that taking certain medications can alter our brain's chemistry and can impact our functioning. So there are three main types of medications that we prescribe for mental illness. I mean, there's a variety of others, but the main types are antipsychotics, anti-anxiolytics, and antidepressants. So antipsychotics reduce the symptoms of schizophrenia, especially the positive symptoms like hallucinations and delusions. So if you recall, we talked about the negative symptoms like the depressive-like symptoms. These don't work so well with antipsychotic medications. They block the dopamine receptors in the brain. If you recall, that dopamine was related to the hallucinations and delusions, and too much dopamine can cause people to start seeing things, and that's why people hallucinate also when they do certain drugs that block dopamine receptors. However, some of the side effects, and these are difficult for a lot of the patients to handle, are obesity, and people gain so much weight that they then end up with diabetes. They also get movement problems like tardive dyskinesia, sluggishness, twitching, and then the tardive dyskinesia can cause the facial and tongue and body movements. Those of you who have ever seen Homeland, Carrie's character when she was in the psych hospital, you can see that her mouth started kind of drooping and things like that. Those would be the signs of tardive dyskinesia, so she was put on antipsychotic medications. Anti-anxiolytics decrease anxiety by reducing worrying thinking and physical agitation, and they work by slowing the nervous system activity in the brain and body. Anxiety responds very well to behavioral and cognitive interventions, and so taking these medications are not long-term fixes, but they help people when they're in crises and they can't think clearly. However, some of the side effects include slow thinking, reduced learning, dependence, and withdrawal. So people can become dependent on this, which is a great danger. Antidepressants are the most prescribed medications, and these improve mood and control over depressing and anxious thoughts by increasing levels of serotonin and sometimes norepinephrine, depending on the type of medication. And then it inhibits the reuptake and possibly the degeneration of certain neurons. Some of the side effects include dry mouth, constipation, and reduced sex drive, which, for some people can be very serious consequences. So many medications increase synaptic neurotransmitter levels by inhibiting reuptake, so preventing the neurotransmitters by being taken up by the neuron again, so keeping those chemical messages in there. So you can see they're being released, and then in drawing B, they're supposed to be reuptake, but the medication, which is the pink drawing in number C, or in letter C, then prevents the serotonin from being reuptake, so it's now available in the synapse, and there are higher levels of serotonin, therefore increasing the mood. So other types of medications that we see are mood stabilizers. These are for people who have bipolar disorder, and stimulants, primarily for those with ADHD. So mood stabilizers reduce the highs and the lows of those with bipolar disorder. It's still investigated how they work, but the side effects include monitoring blood levels. Certain medications like lithium can be very toxic if they're not monitored properly, and people, especially in the throes of mania or depression, can commit suicide, and so you have to make sure that people are properly monitored. ADHD, people, contrary, people are hyperactive. You'd think the last thing you want to do is give people stimulants, but it seems to help control the impulses and reduce distractibility, and so people can focus. That's why kids are also abusing them, because it helps them study, stay awake, things like that. It works by blocking the reuptake of dopamine from the synapses, and one of the side effects is decreased appetite. So you might not be aware that we still do electroconvulsive therapy, or ECT. If you've ever seen the movie One Flew Over the Cuckoo's Nest, it can be seen as something that's very aversive. However, what we do now is instead of doing it bilaterally, we do it unilaterally, meaning that we only shock one hemisphere of the brain and not both hemispheres of the brain. We also put people under general anesthesia, and we give them a muscle relaxant so that you would actually see very little. There used to be a large degree of memory loss associated with ECT because it was done bilaterally. Now with the unilateral seizure, the memory loss is usually just relegated to the few moments before and after the ECT, and generally people seem to do very well. I've seen patients before and after ECT, and they're completely different people. Now, this is not necessarily going to cure somebody. It helps them get out of a really depressive period. But we don't exactly know how it works yet. They might allow for neural rewiring. It might boost neurogenesis. People don't exactly know. All we know that it works. One of the things they've been investigating now is repeated transcranial magnetic stimulation. So people can either have the magnets on top of their head, as you see here on the left, or these can be actually implanted in the brain, and they can disrupt the electrochemical brain patterns. Again, we don't know exactly how they work. We do know that it does work, but these are only used in cases for people who have really, really severe depression that does not abate, and this is kind of the last chance. They've tried everything else. Another thing that used to happen, we don't really do this anymore, is psychosurgery. You may have heard of the lobotomy, where people's frontal lobes were removed or severed. Usually this is done through the eye orbital. One of the Kennedy sisters had this done back in the 1950s. However, it impairs people's judgment, initiative, etc., and so they end up being kind of in a vegetative state after this is done, so they've stopped doing this. Microsurgery is something that we are still investigating. If you zap certain areas of the brain that are associated with aggression or obsessive compulsive disorder, you can decrease some of those symptoms, but again, I think this is still in its relative nascence, so we don't know too much about this, and obviously by zapping parts of the brain, we're destroying them, and so it's very dangerous, and so this would only be used in very extreme circumstances. One other thing that you can do to change the brain chemistry is change your lifestyle. So we can exercise, because that boosts the level of serotonin in our brains and reduces stress. It can change negative thoughts and improve mood and rewire the brain. And mental health problems can also be reduced by meeting our basic needs for sleep, nutrition, light, meaningful activity, and social connection. So when I treat somebody with depression or anxiety, that's one of the things that I make sure that they're doing, is that they're sleeping properly, they're eating properly as much as possibly, as well as trying to go out, have social activity, interact with the world. And all those help with brain chemistry as well. So that's something to consider if you're ever feeling down. We always want to hibernate in our apartments or our homes, but we know ultimately that just makes us feel worse. And so actually getting out, taking a shower, doing some exercise can make you feel so much better. And so that's what we encourage people to do first and foremost before even prescribing medication. So that's